Okay guys, I am done numbing. We numbed me for about 20 minutes and Melanie is going to start my microneedling. So I'm just going to lay back and enjoy my this process, and she'll tell us all we need to know about getting microneedling.
Okay, so with microneedling, what I'm going to do first, I'm going to wipe off, I kind of wipe off the numbing cream as I go, so that way it continues to numb. And I always do the cheeks first, because the cheeks are a little bit, there's more tissue there, and then I do the T-zone last. So as I take off the numbing cream, I'll kind of explain a little bit what microneedling does. Microneedling, it's a tool that actually goes up and down. It has like 12 needles on the end, and it causes a little bit of a trauma to the skin. What it does is causes trauma to the skin. It goes down just barely to the dermis, so it goes through the epidermis and down just a little bit into the dermis, really not a lot. Causes trauma, which in turn stimulates the collagen and elastins to tighten. It also will help reduce the pore size. It helps with the pigmentation. If you have any type of scarring, it's great. It's a great treatment for that. You always, depending on your skin and what you need, so you always will need at least 1 or 2 treatments, sometimes more, depending on the results that you want and what issues you are focusing on. So I'm going to first put on a hyaluronic acid. What this does too is it infuses the hyaluronic or different kinds of serums that you can put into it. You can do a vitamin C that infuses into the skin and goes down a little bit deeper than it would if you were just putting it on the top, on the epidermis.
I was going to say, I feel like I loved it even from the very first time she did it. So I started getting microneedling done about a year ago, and I think I had 3 sessions. I had 2, and then I got pregnant, so we did a 3rd session without numbing cream. But then after that, I didn't want to do it without numbing cream again. But I think that microneedling is probably hands down the best treatment I think I've ever done on my skin. That it shows you the best results the fastest, and I see a difference immediately.
It does. The microneedling is probably, if you want kind of a BAM results, this is the best treatment to do, where you get results right away that you can see.
Yeah, so this is my second one of I'm gonna do a six
A series
like
of 6.
a 6 series, treatment, and then we'll see if that lightens up my melasma. And I mean, melasma's hormonal, but it'll also help from the outside and help my hyperpigmentation. And I don't have a ton of acne scarring, but I have enough from picking at my face.
Yeah, it helps to even out the skin tone and the texture. It honestly is a great treatment. What I would like to do too with her is I would like to do microneedling, but I also would like to throw in a couple chemical peels, because I think that will really benefit, and she will definitely see a change in her skin as we go. So it would be fun to show you the progress.
Awesome.
So, okay, here is the tool that I use.
Here, there you go.
It's the microneedling. If you look on the tip, I don't know if you can see it very well, there's like 12 needles up there that goes up and down, and causing the little trauma to the skin.
There you go.
There you go. Sorry, I can't really see.
She can't see where she's putting it.
Okay.
So the pen itself, this is you use that over and over, but then the cartridge is a one-time use.
Yep, this is new. I just took it out of the package. You also, if you see these little this dial right here, starts at 0 and goes up to 2.5. That's where I can raise the needles up to increase the depth or bring them down.
So you'll do it like thicker in my cheek and then lighter on my forehead.
Right, on the cheeks, I will go a little bit deeper. And if there's areas that I feel like that need a little bit more work, I may go over that area a couple times. When you microneedle, you go over the area 3 times, vertical, horizontal, and vertical. And sometimes I may even stop and do a
Diagonal.
Diagonal, sorry, diagonal. I might just stop and do a little circle because I feel like, oh, I want to work on that area. But anyway, so let's get started.
And so I know just from people watching this video, I know the goal is to find the pinpoint bleeding.
Mm-hmm.
I personally, just for you guys watching, I just genetics, I'm not a big bleeder. So we can have my depth up pretty darn high and I won't ever bleed as much as, have the pinpoint bleeding as much as some other people do, just for their knowledge.
All right, I'm going to wipe right here. I have, I just want to make sure I have it all off. I'm actually just going to do this section, but you can see a little bit of the numbing cream right there. And I don't take it off the, right here, her jawbone, just because I do that section last. So I just want to make sure that I leave that on for my last section, but I don't want it to interfere with this area that I'm going to be working on. So let's add a little bit more of the hyaluronic. That helps it glide, and it also infuses into the skin. This is a great hydrator, hyaluronic acid is. Okay, so here we go. And I got this on about 1.5. I usually start a little bit conservative, and then if I need to raise it up, I will. And I don't think she's feeling anything right now, are you?
Mm-mm.
You just feel the gliding?
Mm-hmm.
Because we numbed her face with BLT is what we call it.
It's benzocaine, lidocaine, and tetracaine, and I think ours is a 28 and 8.
Yep.
It's pretty powerful. That's why I didn't use it when I was pregnant, because we just don't know. You just really don't ever want to put something into your system when you're pregnant.
Yeah, that's the contraindication. You shouldn't do it. When you're pregnant, use the numbing cream anyway. We did it without the numbing cream, and she was very brave.
I practiced my hypno breathing.
So if you notice, there really isn't a lot of pinpoint bleeding, which with her I know that. So I'm going to actually add a little bit more hyaluronic acid, and I'm going to go up. In my notes, I know that I used 2.0 when I did it before on her cheeks. So I started off at 1.5, but I'm just going to go right on up to 2.0. I just didn't, I don't think we've done it since you've been pregnant, right?
Maybe once. I can't remember.
Anyway, we're doing 2.0 now. You doing okay?
Mm-hmm. Is there any pinpoint bleeding yet?
Mm-hmm. It's right there. You can see
Perfect.
some.
Yeah, you guys, I can't feel a thing. When it gets to my nose, I'll make a funny face because it tickles.
But you can see it starts to come up, and that's exactly what I want to see. These are my endpoints. Do you see how it's just, you know, a little bit of pinpoint bleeding? So it's going down and causing just a little bit of trauma, stimulating the collagen and the elastins, help with the texture, even out the skin tone. Okay. I'll stop every so often and wipe a little bit. Let's just
It's kind of fun to watch it.
Okay, so on the, whoops, got it over there. On the, when I go around the eyes, I always raise it up just a little bit. It's the skin, it's just a little bit more sensitive around there, so I don't want to go I don't want to have the needles as high as I did in this area. But right here, I can still keep it a little bit higher, but just right here. You right?
Mm-hmm.
Can you feel that, or is it just
No,
tickle?
it's my nose.
Okay.
Nope, I can't feel a thing.
This also is a great treatment to help reduce the pore size. So if you feel like you have really big pores on your nose, great treatment for it.
I think my daughter's coming in. Hi, Reese.
Hi, Reese Bug.
I thought the door was locked.
It
No.
wasn't locked. Can you see what Mommy's doing?
Yeah.
It also helps with the fine lines. So we're gonna
make it look like I don't have 3 kids.
right here. We're just gonna get those fine lines. It's okay,
You
Reese
got it,
Bug.
baby?
Sure.
Ooh, what is these?
What?
Is this glass?
No, well, if you drop them, they might break.
Is this glass?
No, it's a shell.
This is how moms get their face done. Your kids come and you bring a babysitter and you hope for the best.
Okay, let's do your right cheek.
All right, so you guys saw the left side. I'm going to just cut it off so you guys can see that, and then I'll turn it back on for my nose and chin, maybe.
The T-zone.
Yeah, we'll do that again, but at least you guys have seen kind of what we're doing, and we'll go from there.
So